So now moving on to assignment 8, obtaining an estimate that is generalizable to the relevant study population in research studies, external validity. Remember estimate, E for estimate, E for external, generalizable, everything estimate that is generalizable is external validity. Any process that tends to produce results that depart from true values, bias. Systematic error it is. Systematic selection of more number of exposed participants with a higher risk of outcome in a cohort selection bias, yes. More number of exposed, yeah. You are selecting only those which will give you good outcome. So that is a selection bias. The effect of the exposure of internal outcome is distorted because the effect of extra that are related to both exposure. Yeah, confounding, correct. Biases can occur during which state of research study. At any of the above stages, yeah. Design and analysis. To regarding may to reduce except deprivation, good, this is good, this is good. Adequate sample size or reduce information where sample size will play no role in this, right? Yeah. So adequate sample size. Variability estimation due to unknown or controllable factors. Chance. Yeah. This is a random error. Random error can occur due to chance. All are true regarding confounding except always change the direction of effect. May simulate, yes. This is not always change the direction of effect. It can sometimes not also change. The alleviate confounding method in a multivariate. Yeah, this is extremely important. Extremely important. Restriction, matching, and randomization are different methods about which I'll be telling you in a short while. But to remove confounding, you use multivariate analysis. Goes without saying. To reduce selection bias in case control studies, or the following are true except apply different eligibility criteria for selecting cases and controls. To reduce selection bias, we will use population-based design, yes. Both case and control over same diagnostic, yes. We avoid hospital-based design, yes. Apply different eligibility. No, if you would apply different, then there will be selection bias, no? Okay, got it. Obtaining an accurate estimate of disease frequency and effect of exposure on health outcomes in a study pertains to internal validity. Accurate, see here, accurate. I told you whenever there is accurate something, it is internal validity. Accuracy and internal validity go hand in hand. And blinding is a way to deal with selection bias and information bias, both of them. Yeah. Better recall of exposure only among cases in a case control study can result in information bias. Yeah, obviously, because someone is recalling incidents better, other one is not. So information bias. Yeah. Ability of a tool to measure what it is supposed to measure called validity. Extremely important definition. Ability of a tool to correctly measure what it is supposed to measure is known as validity. Then bias may distort the association between exposure and outcome of the study participants. True. Case control patient selection bias, correct. Researchers studied the effect of coffee drinking. The effect of coffee drinking was distorted. This is confounding, I think so. Yeah, third factor, correct. Which other following are used to address for known confounders? Matching. Yes. Address for at designing stage, we use matching at the designing stage of the study. Blinding, no. Matching, randomization, and one more thing I've forgotten that is used in the designing stage. Systematic distortion of the study. This is extremely important. This is prevarication. Yeah. Systematic distortion study by study subject known as prevarication. Crude association, the presence of a confounder. Crude association, the presence of a confounder is actual causal. No, false. Crude can never be actual causal. The following best method of showing that experimental and control arms in experimental study are similar regard to known and unknown confounders. Yeah, randomization is the bestest thing. That is why randomized control trials are so much high weightage they have, highest level of evidence. Obviously, I know you will say that, sir, it's not. I know that's true. Systematic review and meta-analysis are obviously the highest level of evidence. But randomized control trial is just below them. Like if systematic review meta-analysis is the first, second is randomized control trial. When a study finding generated, then it is externally valid. See, I told you Generalizable. E here. The following can do selection bias in a case control study. Inclusion of controls not representative of the target population. Yeah. This can be selection bias, correct. Differential recall, this is recall bias, correct, right. Differential recall. Getting data differently from exposed and unexposed. This can result also maybe in information bias. System, not sure about this. Systematic distortion of truth is prevarication. No, is it? I think so. It is prevarication. Yes, it is. Okay. Then we are following is true about information bias in a cohort study. It can be avoided by uniform outcome ascertainment. Okay, this is true. If you use uniform outcome ascertainment, setting control. Okay, which of the following is not a systematic error? Random error, yeah. A systematic error is basically bias. Confounding everything is systematic error, yeah. The following measure is rated on showing the internal validity. All of the above, yeah. The following is false about confounding in epidemiological studies. Confounding does not increase or decrease. No, this is not the case. Yeah. Systematic collection of data by an investigator supporting an expected conclusion, epidemiological result, and yeah, information bias. Yeah, because the principal investigator is collecting data knowing that we are going to get a positive result. Please do publish all negative studies. I strongly encourage you to publish all the negative studies. Don't get an association. Please do publish. We don't need, let me reemphasize and reiterate this fact again and again. We do not need papers showing us always a correlation. Even if the p-value is less than 0.05, it is statistically significant. Even if it is greater than, please publish the result. I am with you in that. Which of the following is not a method of dealing with confounding during the study design stage? Yeah, design stage stratification is not done. Yeah, this was the one. Yeah, not in the design stage. Correct. Then a cohort study is connected to the association. Okay. And then the gender confidence for help in confounding effect. Yeah, multivariate regression. Now you have to use those regression models, linear logistic regression models. Yeah, because this is during analysis. So during analysis we use multivariate analysis, but during the design stage, I have told you